By the end of this module, you will understand the epidemiology and burden of falls among older adults, conduct comprehensive fall risk assessments using validated tools, modify home and care environments to reduce hazards, implement fall prevention protocols and emergency response systems, support elderly patients and caregivers in regaining confidence and independence post-fall. This module tackles one of the most critical and preventable threats to elderly well-being: falls and environmental hazards. Falls are the leading cause of injury-related death among older adults worldwide, with consequences that range from minor bruises to fractures, disability, loss of independence, and even death. Module 6 presents a multidimensional and holistic approach to understanding fall risks and implementing effective safety interventions at home, in care facilities, and in community settings. The module is designed with guidance from internationally recognized frameworks such as WHO Global Report on Falls Prevention in Older Age, NICE Guidelines, CG 161, on Falls in Older People CDC STEADY Program, Stopping Elderly Accidents, Deaths, and Injuries, the Patient Safety Movement Foundation, American Geriatrics Society, Fall Prevention Guidelines. Understanding fall epidemiology in the elderly. Falls account for over 40% of injury-related hospitalizations in those aged 65 plus 1 in 3 elderly individuals experiences at least one fall annually. 20 to 30% of falls result in moderate to severe injury, e.g. hip fracture, traumatic brain injury. Psychological impact. Fear of falling leads to self-imposed inactivity, depression, and increased frailty. Multifactorial causes of falls. Intrinsic factors, individual specific, muscle weakness, gait imbalance, dizziness, polypharmacy, cognitive impairment, poor vision, low blood pressure, orthostatic hypotension, foot deformities, chronic illnesses, e.g. Parkinson's, stroke, osteoarthritis, extrinsic factors, environmental or situational, poor lighting, slippery floors, loose rugs, uneven surfaces, inappropriate footwear, lack of grab bars or handrails, cluttered pathways, disorganized living spaces, behavioral factors, rushing, multitasking, not using assistive devices, improper use of mobility aids, fall risk assessment tools, timed up and go TUG test, Morse Fall Scale, MFS, Berg Balance Scale, BBS, Stratify, St. Thomas Risk Assessment Tool, Home Hazard Checklist and Environmental Audit, Assessment Frequency, DOT, on admission, post-fall, every 6 to 12 months in institutional care, environmental adaptations and ergonomics, home modifications, installing grab bars, non-slip mats, raised toilet seats, widening doorways for wheelchairs, proper lighting in hallways and staircases, removing floor clutter and cords, assistive devices, period, walkers, canes, stair lifts, fall mats and alarms, hip protectors, furniture adjustments, DOT, chairs with armrests and proper seat height, bedside rails and adjustable beds, smart technology in safety, motion sensors, wearable fall detection systems, voice-controlled lighting, GPS-enabled emergency alert devices, fall prevention strategies and protocols, exercise programs, Tai Chi, balance training, resistance workouts to improve strength, gait and posture correction exercises, supervised physiotherapy for high-risk individuals, medication review, identifying and deprescribing sedatives, antihypertensives, or diuretics where possible, coordinating with pharmacists to reduce drug interactions and side effects, vision and hearing checks, timely correction of visual impairments, e.g., cataracts, glaucoma, fitting appropriate hearing aids to enhance orientation, patient education and empowerment, teaching safe ambulation practices, involving caregivers and family in daily safety checks, fear of falling programs, e.g., a matter of balance, chronic pulmonary conditions, chronic obstructive pulmonary disease, COPD, includes emphysema and chronic bronchitis, persistent cough, dyspnea, wheezing, Inhalers, oxygen therapy, pulmonary rehab, asthma in elderly. Often underdiagnosed, triggers, cold air, allergens, medications, kidney and liver disorders, chronic kidney disease, CKD, reduced glomerular filtration rate, GFR, symptoms, fatigue, nausea, edema, confusion, complications, anemia, acidosis, electrolyte imbalance, liver cirrhosis, often from alcohol use, hepatitis, ascites, jaundice, variceal bleeding, liver function monitoring essential. Cancer in the elderly, increased incidence due to aging cells and reduced immune surveillance. Common types, prostate, breast, colorectal, lung, importance of early detection, screening programs, psychosocial support and palliative care, comorbidities and multimorbidity management, complex interactions between diseases, polypharmacy risks, drug-drug interactions, adverse effects, role of interdisciplinary teams, holistic care planning using frailty index, comorbidity scales, preventative and proactive care approaches, regular screenings, BP, blood sugar, cholesterol, cancer, lifestyle modifications, smoking cessation, weight loss, mobility aids, nutritional counseling, exercise programs tailored to chronic conditions,